Greetings, my name is Megan, and I'm a new patient supervisor at Patients Medical. Patients Medical is a holistic medical center in Midtown Manhattan, and I'm so excited to be here today with Dr. Gino Bottino. He's our holistic oncologist, and September is Ovarian and Prostate Cancer Awareness Month. And so that's why we're here with Dr. Bottino today to give us some best practices on how we can stave off cancer, or at least have the best chances for doing so. And for those who have already been diagnosed with ovarian or prostate cancer, how they can move forward incorporating holistic recommendations. So Dr. Bottino, thanks again for being with us today.
You're welcome.
So tell us, when should people start getting checked, and what's the best practice with that?
Well, the first thing I would say is that we should start with an understanding of how common these things are. Okay, so for prostate cancer, there are about 165,000 cases in the United States every year, new. And somewhere around 35,000 men die from prostate cancer every year. And it is the most common cause of death in men from cancer over the age of 70.
Wow.
So prostate cancer is pretty common in men. Ovarian cancer is the 5th leading cancer in women, and about 1 out of 90 women will get ovarian cancer.
1 out of 90?
Yeah, but it's not actually as high as it. What happens is that somewhere around 50,000 women will be diagnosed with ovarian cancer, which is like a third of prostate cancer, and only about 25,000 will die of it. So it's the 5th leading cause of cancer death in women. But it's not, it's still fairly common. It's something that we look for and that we're concerned about.
And these are both things that can be checked fairly easily.
Yes, that's true. How do you check for it, I guess, is before you even get to how you check for it, you really want to have a discussion about who should be looking and when, right?
Mm-hmm.
Because do you need to be looking when you're 20?
Probably not.
Probably not, right, exactly.
Unless, are there any special cases where you should?
Yes, actually. Well, both for men and women, prostate and ovarian cancer are age dependent, and their peak incidence is around after the age of 50. And it's pretty uncommon, both of them, before the age of 40. So usually screening does not occur before the age of 40. And one little caveat is I've seen patients in their 20s get ovarian cancer, and I've seen patients in their 30s get prostate cancer. So if you have a strong family history or genetic history, the usual type comments are out the window.
Right, to be checking even more diligently.
So some interesting things about prostate cancer are that certain certain jobs are known to be related to prostate cancer.
Really?
Yeah.
I didn't know that. Which jobs?
Farmers, people who work with cadmium, which is basically the dye that they put on like watches and wristwatches and stuff,
Really?
and cadmium workers in that process that substance, and painters, outdoor and indoor painters. All of them have a higher risk of prostate cancer because of the volatile toxins that they are exposed to.
Really?
And because of that, those group of people should be more aware. Right?
Well, that's very important to note then. Those people who have those occupations, please get checked.
Also, tire plant workers.
Okay.
In tire plant workers for prostate cancer.
All right.
So it's interesting, isn't it?
Yeah.
And in women, it's more hormonally based. Women who have had children later in life than earlier in life, and women who have had fewer children than more children have a higher risk.
Okay.
And women who have been treated with any kind of hormonal therapy, especially a fertility drug, have a much higher risk.
Okay.
So those things are true in women.
So especially for women who are trying to have children later on in
Right.
life, they're taking these fertility
Right.
treatments, they're having a couple of children or maybe one later on.
Right.
Definitely, this is an
Right.
area where they need to get checked.
Also important is people's weight. Obesity is very associated with both these diseases. And diet is also important. People who eat high diets of fat, and especially processed food fats like McDonald's burgers, have both have a higher incidence of ovarian cancer and prostate cancer. So diet and how you and how you eat is very important.
And that's something we can totally control.
Right.
It's not like your
Totally
job
control.
where you may be stuck in for one reason or another. Your
That's-
diet, you can upgrade your diet at any
That's
time.
correct. Right. And in the sort of line of diet in terms of prevention, there are certain things that we know of, supplements, that are absolutely proven to reduce the risk of prostate cancer. And one of them is saw palmetto, another one is lycopene, another one is pomegranates.
Okay, so saw palmetto, lycopene,
pomegranates.
Right.
Right. Exactly. We also know that decreasing inflammation of these glands leads to less cancer. And so in men, a lot of men are prone to getting infections of the prostate. You want to try to calm that down. The prostate gland is very sensitive to spices, so it's actually not a good idea to have a very high spice diet as a man, because it does affect your prostate and causes inflammation. And those things are known also to trigger prostate cancer. The same thing is true in women, virtually the same thing. The same additives, and not the same additives, I'm sorry about it, the same diet, the same fat restrictions, the same weight restrictions are all true. The inflammation is true.
Okay.
That's all true. They do not have specifically identified supplements that like prostate cancer. On the other hand, supplements that reduce inflammation in general, like antioxidants, like CoQ10, things like that, are probably very helpful.
Okay.
So there are a lot of things that women and men can do to reduce their risk and start from an early age. You don't start at the age of 50. Because,
that's not when you decide to get healthy, right?
That's too late. You really want to start.
Better late than never,
Right.
but
You want to
better
start
earlier
it,
than
right?
late.
But you want to start at 20.
Okay.
You really want to start at 20. One special thing about women, and I mentioned this before, that both men and women with prostate and ovarian cancer, there is a genetic component to it, and there is a familial component where if it runs in your family, your risk is very high. Now, the difference is, in women, we have found an abnormal gene called the BRCA gene, which is related to cancer in women, and including breast cancer, and also colon cancer. So those things in a family, would predispose you to getting ovarian cancer.
So how do you find out if you have the BRCA gene? I know that's the
Well,
$10 million question here.
Right. Well, the test is fairly expensive, and it's about $2,000. You can pay for it. Or the insurance companies will pay for it if you have an appropriate family history, including those cancers that we mentioned. So that's how you get that tested for as a female.
So as a patient, you would want to work with your doctor,
Right.
check out your medical history, and then look into the insurance end of it and see if you can get a referral for it.
Right.
Or something like that.
Exactly.
Okay.
In terms of making a diagnosis, really the best thing for both diseases is simply to see your doctor. The nice thing about organs that are palpable as opposed to ones that are not palpable, and that means you can touch them, is that you can feel for lumps. Whereas, like, for instance, your pancreas or your stomach, you can't feel for a lump. With your stomach, at least, you can put a scope down and look, but, you know, with some organs like kidneys and pancreas, it requires a scan, like a CAT scan or something, to look at them, and they're expensive also. With prostate cancer, it just requires a finger. And so the number one tool for prostate cancer evaluation is a digital rectal exam. Right?
And however unpleasant that may be, it could save your life.
And with women, you know, the number one tool is a GYN exam. It's the same thing, really. So in both situations, ultrasounds done by urologists and by gynecologists can also be very helpful measuring the size, and they're not expensive tests and they're pretty routine. And there are some what we call tumor markers that can be looked at. Now, tumor markers for prostate cancer are much more specific than for ovarian cancer, but there are specific ones for both. And we are using these tests more and more. There's some controversy as to the use of these tests in a generic population because of the issues of cost versus the good for the population.
I see, they're very expensive.
Well, it's not like they're terribly expensive, but the thing is that when the government looks at this, they're really looking not so much at the individual's benefit, but they're looking at society's benefit, cost versus benefit. And so you may hear them say, well, the PSA is not a great test for screening, or the CA 125 for ovarian test is not a great test for screening. That's because they don't want to pay for it.
But as a patient who's advocating for yourself, you can request these tests.
Yes, you can request them. You definitely can pay for them yourself. And under circumstances that we talked about, like if you have a risk factor, for sure it could be covered.
Great.
So that would be something.
Here's the inside scoop from Dr. Bottino.
Yes.
Okay, great. And so women should start getting checked after menopause.
Well, you know, for women, obviously, going to a gynecologist early on and staying with your gynecologist is really the key to success for avoiding, you know, female problems in general, and not just ovarian cancer, but cervical cancer and infections that are important. Some of them can cause cancer. I mean, everybody's heard about Gardasil, for vaccine of cervical cancer and stuff, but because of HPV infection, which so there again, which causes inflammation. Inflammation often leads to cancer. So it's a common thread, right? So going to your doctors basically early on, and getting good preventive medical care, and doing the right things. I mean, it takes work to be healthy. People aren't healthy for not. It takes work. Just like with heart disease, it takes work. You have to work at it.
Yes, yes. So developing a lifelong relationship with your doctor in order to prevent all types of diseases, not just ovarian and prostate cancer, is the recommendation.
Yeah.
So now we already talked about holistic things that patients can do to help prevent cancer, the supplements you were talking about. So what about people who already have the diagnosis of ovarian or prostate cancer? Do you have any recommendations for them?
Well, one of the things that has happened in medicine lately is that, again, along the same lines of the great cost of medicine to government and the great profit of insurance companies, is that they tend to reduce the treatment of patients to just the treatment of the disease and not the whole patient. And because of this, People don't feel comfortable. They don't feel like they're being treated well. Every doctor understands that a person is integrated, and a holistic approach is absolutely the right thing to do.
Makes sense.
It doesn't make sense, for instance, it's a well-known fact that if you get like lung cancer and you continue to smoke and drink, your chance of doing well are really poor because you haven't changed your personal habits. And the same thing is true with overweightness, with these diseases, including ovarian cancer and stuff. So the thing is you do need an integrative approach. You do need a holistic approach. And people can do that on their own, which is kind of what they're being forced into, reading on their own, doing it on their own, because their doctors don't have the time. They're paid by the government, whatever, $20 to see people, and they got to see, 20 of them in an hour. And, it's hard. It's hard for them to sit and have a conversation about what your diet should be. So they don't.
Mm-hmm. Absolutely.
So my feeling is that that most doctors know what the right thing to do is. All of us,
mm-hmm.
anybody, not just holistic doctors.
Mm-hmm.
You just have to pin them down and get them to sit with you and talk to you about it all.
Mm.
And that's the trick. Sometimes it's hard to pin down physicians when they feel stressed.
Of course.
And that's why coming to a place like our medical practice at Patients Medical is is a good thing, because what happens is you get to sit and the doctor talks to you about everything, because that's what we do, and that's what we're interested in doing, and that's why we don't have traditional medical practices.
Absolutely. Well, and just to clarify that a little bit more, what Dr. Bottino is talking about is here at Patients Medical with doctors such as Dr. Bottino, new patients will meet with him for about an hour, more or less, just depending on the case. And we'll be able to explore your entire medical history and talk about many different options, including every
an hour and a half, 2 hours.
Yeah. So as much time as you need to speak with the physician, not rushing through after a few moments. So that would be the difference between more of a conventional medical practice and Dr. Bottino's approach here at Patients Medical. Any other last kind of parting words for people who are concerned about ovarian or prostate cancer and really kind of making a concerted effort?
Well, I think the parting words should be that it's easier to prevent than to treat. And so, having a good outlook on your own personal health and making sure that you spend time and work at your own personal health is really the key to having a good, healthy life.
A good investment.
Right.
What do they say? The ounce of prevention is worth a pound of cure.
Absolutely.
All right. Well, thank you so much, Dr. Bottino. Really appreciate you being here with us today, and thank you for tuning in. Again, we're Patients Medical. We're a holistic medical center in Midtown Manhattan. If you would like to learn more about Dr. Bottino and his holistic approach to cancer treatment and many other things, you can go to our website, www.patientsmedical, that's PATIENTSMEDICAL.com, or you can give us a call, 212-661-4441. We look forward to hearing from you. Thanks.